Former President Gloria Arroyo will undergo a delicate cervical spine operation. She is suffering from a disorder called cervical spondylosis, in which there is abnormal wear on the cartilage and bones of the neck. Now, joining us in the studio to tell us more about this and to clear up all the misconceptions, I suppose, is Dr. Antonio Sison, the head of spine section of the Department of Orthopedics at the Medical City. He's also the president of the Philippine Spine Society, or the Spine Society of the Philippines. Good morning, Doc.
Good morning.
All right, so we were talking a little bit off cam about cervical spondylosis. Yes. And perhaps the best way to start really the discussion is to define exactly what we're talking about here.
When it's a cervical spondylosis, it's a disease that goes with the aging process.
Okay.
It's called cervical because it occurs on the cervical spine.
Okay.
Spondylosis because it is a degeneration of the intervertebral disc. This is a body, soft tissue that is situated in between the vertebrae. And this word, spondylosis, is interchanged with the word arthritis or arthrosis, which is also a degeneration of the joints at the back, apophyseal joints. So together, this is what we call cervical spondylosis or cervical osteoarthritis.
Okay, so it's old age.
Yes.
All right. Well, we did want to discuss, I mean, whether or not this condition is as serious as we are led to believe, as people do believe it is. Are there any misconceptions, perhaps, that we should clear up about this disease?
Yeah. Before I go into that, may I tell you the symptomatology of this?
Yes.
Clinically, it can manifest in three ways. One is pain at the neck, which we call a discogenic pain because of the disc degeneration. The other is radiculopathy, which results from a pinched nerve. If the nerve is compressed, the pain travels from the neck down to the extremity. And the third is myelopathy. When there is pressure on the spinal cord itself, then there is weakness. So these are the three possible clinical manifestations or a combination of them.
Okay, so you're talking about any kind of, you know, when we use the general terms, I have a pinched nerve, or parang may naipit na ugat.
Yes, that's right.
That would be essentially
part
of it.
Yes.
Okay, and this is caused by, you were talking about the nerve being pinched between the vertebrae,
yes, that's right. Yes, because the joint or the canal of the vertebra of the spinal cord is narrowed because of degenerative changes.
Okay. All right. So that is the essential cause. I mean, it's the nerve literally being pinched or impinged. Or,
yes, that's right. Or compressed.
Okay. Perhaps we can discuss what one should be doing if one should be feeling something like this. Treatment
of cervical arthritis, or for that matter, arthritis in general, is generally conservative. When we say conservative, it's non-surgical. And when it's non-surgical, what do? We apply heat, exercise, then we give medication. And this is the conservative way of treating it.
When we say medication, what are we talking about here?
The different NSAIDs, pain relievers, anti-inflammatory drugs. Then the other extreme is surgery. That is, if the disease is not checked, if it becomes disabling, then we consider surgery.
So in your opinion, if somebody is able to walk around and function, although perhaps maybe in discomfort and in pain, is that considered
surgical?
No,
not necessary. Not necessary. There are three specialists that treat this kind of disease. Physiotherapists, of course. He or she will tend to treat the case conservatively. Or rheumatologist. Even a surgeon should treat the case conservatively at first. Then only when the conservative treatment fails will he consider surgery. Okay, when you do talk about surgery, what exactly are you talking about? What are you going to do? Well, the bottom line is decompress so that the compression will be relieved. So that's the essence of the operation. Well, in this particular case, centering on cervical spondylosis, it's referring to the neck. It's referring to the neck, yes, that's right. But what if it's on your lower back? Oh, that's different. We call it lumbar disease. It can also happen on the lumbar vertebrae. In fact, It's very more common on the lumbar vertebrae, low back pain, yes.
Okay, you were, pardon me, you were talking about, you wanted to talk about certain misconceptions about the condition.
Oh, yes. I have read in the papers and saw on TV that they say that this disease is an emergency. Emergency operation is necessary. There's no such thing.
Okay.
There is no such thing as emergency operation for a cervical spondylosis.
Okay.
Because it takes time through the years to develop. Second, it does not cause paralysis.
Okay.
Because again, it takes a long time to develop, gradually, very gradually.
Okay.
And the third
but not impossible. But not impossible to see.
Yeah. And the third is it's very risky. Of course not. It is a delicate operation, but we have experts. That's why we have eye surgeon, we have an abdominal surgeon, a spine surgeon. And if the spine surgeon does the surgery, then I'm sure the operation will be successful.
Okay. It's not uncommon to feel these twinges, pains in the neck. I mean, I feel them every so often.
Yeah, that's right.
Is it, when do you know it's something that you should be a little more concerned about? I mean, it's fairly common to say na may naipit na ugat or I feel a pinched nerve. When do you know that it should be something that a doctor should be
if it affects you?
About? Okay.
If affects you, if you're disabled, if you feel discomfort about it, if you feel that your function is diminishing because of the problem,
okay,
that is the time maybe you seek the opinion of an expert.
And most common course of treatment would be to apply heat?
Yes, I said it's either non-surgical or surgical.
Okay.
But we always start with non-surgical treatment.
Okay.
Yes.
Who would be most at risk from this condition?
Well, of course, this disease occurs in the elderly people. So there is an added risk because of the other conditions that affect an aging person, like cardiovascular, diabetes, so on and so forth. So we have to seek a clearance before surgery.
Okay. Just because you're aging or getting older, will it automatically mean you will develop this condition?
Well, yes, all of us will develop degeneration, but some people manifest the disease more prominently or more profoundly clinically, yes.
Okay.
That's why you have it, I have it, but maybe I feel the pain, maybe you don't feel the pain yet.
For people who are extra active, people, is it a condition that you can develop? Say you fell off, you were riding a horse and you fell off and you hit your head and you hurt your neck. Is it a condition that you can develop from trauma? Is it a condition that more active people can develop from, as we say, overuse? Is it overuse
yes,
injury
that's
as
right.
well?
Because when I say degeneration, actually it's wear and tear, and trauma will aggravate the problem.
Okay.
So the person who has had trauma is prone to developing more problems later on.
So you may injure yourself now, hurt yourself now, and it can be something that will manifest itself later on.
Yes,
as a cause of that. Okay.
Right.
To ensure that we don't develop it as you know, as early or later than earlier, or make sure it doesn't hit us as hard as it would or possibly could, what can we be doing to ensure that?
Yeah, as you said, the word overuse, you remember that. Do not be overactive. You be active in moderation, something like that. That's why, you know, these athletes, they retire early because of wear and tear of their joints.
Right.
Yes,
in terms of food, diet, is there something? Are there things that you hear stories of? Oh, eat food that it's rich in certain types of proteins or ingredients which will lubricate your joints or things like that. Is that is there any truth to that in your opinion?
You know, the food supplements. Well, they claim there is an effect on that, but scientifically, not proven. Not proven.
Okay, so it's again the condition is something that is fairly common. It can happen to most people. In fact, it happens to almost everybody who ages, but it manifests in different ways and it's perceived in many different ways.
That's right.
And it's not as serious as we may believe in majority of the cases, but certainly something that we should all still be concerned about. Take care of your bones.
That's
in the
right.
end.
That's right. That's
Okay.
right.
Well, thank you so much for sharing that
Thank you very much.
sharing that with us, Doc, and clearing up all those misconceptions that we had. I'd like to say thank you to Dr. Antonio Sison, the head of the spine section of the Department of Orthopedics at the Medical City. Thank you, Doc.
Thank you very much.
All right, folks, coming up.